अस्सलाम वालेकुम। कैसे हैं दोस्तों, आप सब लोग खैरियत से हैं? मैं भी बिल्कुल खैरियत से। दोस्तों, जैसा कि हमने अपनी लास्ट वीडियोज़ में आपको बहुत ज़्यादा इन्फॉर्मेशन देने की कोशिश की स्टडी अब्रॉड में मलेशिया के हवाले से, मलेशिया की यूनिवर्सिटीज़, मलेशिया में एजुकेशन आप किस लेवल पे कहाँ-कहाँ, कौन-कौन सी एजुकेशन आप हासिल कर सकते हैं। इसी तरीके से दोस्तों, आज हम आपके लिए एक ऐसी इन्फॉर्मेटिव वीडियो बनाना चाह रहे हैं जिसके बाद आपका स्टडी अब्रॉड में मलेशिया के लिए आपका डिसीजन लेने में बहुत ज़्यादा आसानी होगी। दोस्तों, तो ये है लाइव टूर ऑफ मलेशियन यूनिवर्सिटी। सबसे पहले हम चाहेंगे कि हमारे पास बहुत ज़्यादा जो क्वेरीज थी, क्योंकि हमारे जो मेडिकल स्टूडेंट्स हैं वो बहुत ज़्यादा क्यूरियस होते हैं इस हवाले से कि उनकी यूनिवर्सिटी किस रैंक की है, उसका वर्ल्ड वाइड रैंक क्या है, मलेशिया में रैंक क्या है और उनके पास क्या क्या ऐसी फैसिलिटीज़ हैं मेडिकल इक्विपमेंट्स के हवाले से और बहुत सारी चीज़ों के हवाले से। तो दोस्तों, मैं आपका यहाँ पे टाइम बिल्कुल वेस्ट नहीं करूँगा। मैं चाहूँगा कि हम डायरेक्ट यहाँ से चलें हमारे नुमाइंदे के पास, जो कि इस वक्त हमें मलेशिया की यूनिवर्सिटी लिंकॉन यूनिवर्सिटी एंड कॉलेजेस में मेडिकल कैंपस का आपसे विजिट शेयर कर रहे हैं। थैंक यू, और आ जाएं, चलते हैं मलेशिया।
Example, you have international student. We process the visa for 2 to 3 weeks. If the documents has no problem, at most 1 month.
Okay.
At most 1 month. So first stop, we are going to enter cyber anatomy. So this is one of the classrooms. Continue. Oh. Oh. So we can please get it done. Mr. Zishan. Okay. The classroom is not going to be congested. Okay, so meaning student can focus on their study. Hello, Miss Lina. Okay. Ladies and gentlemen, I would like you to meet Madam
Hello.
Lina.
Oh,
She-
hello. So okay. So good afternoon. My name is Lina. I'll introduce you to my colleagues. Yeah. My name is Lina. I'm the skills lab manager over here. Okay. I will. This is my colleague. His name is Irfan. He's in charge. He's an MLT. Basically, MLTs are in charge of all the labs. Yeah. So over here, just for medical alone, we have about 10 labs. Yeah. But total, we have about 20 over labs over here.
Okay.
Yeah. Okay. Please have a seat. Please have a seat. Have a seat.
Okay, Madam Lina, let me introduce them to you. Mr. Zijan, the agent of the Paramia, Liam, Justina, Alif, and Erin. So they are doing the local marketing. Justina and me are doing international marketing. And he's the agent of the Paramia.
Oh, okay. All right. So this one. Okay. So basically, this is called cyber anatomy. Yeah. Over here in Lincoln, we have three anatomy labs. Yeah. The first one is cyber anatomy. The other one is museum anatomy, and the last one is the anatomy plus dissection hall, where we have real bodies. We have 3 real bodies in the dissection tank.
Okay.
Okay, all right. Even in the museum also, the bodies are all real, but they have been plastinated. Yeah, everything that you see inside in the museum is all real parts of
Okay.
human.
Okay.
Yeah. Okay. So I'll just roughly explain what is cyber anatomy. Cyber anatomy is software where students learn about the whole anatomy, virtual, 3D. Okay, it comes in a 3D software. So they learn all about the anatomy virtually. Okay, so this is a software which we acquired in the year 2012. Yeah, it's American software, and in the year 2012 until now, okay, we are the first university to acquire this software, this cyber anatomy. And in Malaysia alone, there's only 2 private universities that have this kind of software, cyber anatomy software. Alright? Okay. So why do students come in here to learn about the anatomy virtually? Because when they learn it through virtually, they can see it more precise. Okay? Because when you see the real body, okay, like say supposing you see the nerves, okay, this can go much more deeper than that. Okay, so that's why they come and see, they come to the cyber anatomy. So let me just briefly show you what is this all about. Okay.
Yep.
Okay, so this is cyber anatomy. And nanti jap, go back. Okay, so we have a new user and experienced user. Okay, so today we introduce the new user. So you just wait a few seconds, and the mental window will come out. Yeah, the mental window is a tool that teaches the new user on how to use all these icons. Yeah, so they can scroll down. Okay, they can scroll down for each and every icon how to use it. Okay, all right. So we close that. Okay, and we go to the anatomy. Okay. So as you can see, students can actually learn about the anatomy from head to toe. Okay, and very precise and very specific. Okay, so whichever part they want to learn about, they can just click on that particular part. Okay, And also this cyber anatomy, they can actually choose whether they want to learn about the female parts or the male parts. Okay, so maybe today we'll learn about the male part. Okay, and maybe we'll click on something that is very simple like the head and neck. So what we do is we just click. Okay, so wait a few seconds. Okay, so we have the head and neck. Yeah, so we can actually see this 360 degrees. We can turn it around 360. You turn it around, up and down. You know, depends on which part you want to see. Okay, so maybe today we want to see, like, say supposing the students want to see the face, yeah, the head part or the face area. They want to see what is beneath the skin, yeah. So they can actually peel. Okay, right. Okay, so when you peel, you can see. So the cursor goes. Okay, so the cursor, as you can see, everywhere that the cursor goes is being labeled. Okay, so easier for students to, students don't have to bring their medical books. Unlike our days, in the university days, where we have to bring thick medical books, right? Nowadays, students won't have to. Just based on the cursor, wherever the cursor goes, okay, it is labeled. So depending on which part they want to see, they can see, yeah, and then we can even see even more precise. We can actually explode the whole head. Okay, we can explode. Once we explode, we can see even more precise and more detail of each and every part. Yeah. Okay. All right. And over here, we also we also have what do you call it? Imaging. Yeah, it's like the X-ray. Yeah. So today, maybe because we are seeing the head part, so like this is the ear. Depending on where you want to go, like this is the ear part. This is an imaging. The resolution is so clear. It is as real as the. It looks as real as the X-ray. Yeah. Okay. And it depends on where you want to see. You can even see the brain. Yeah. Depends on where you want to see, which part you want to see. Then we can just move, and then we can see the whole head and that is the part. Okay. And over here we also have visible human, which is a cross section of our body. Yeah. So boleh besar sikit. So this is a cross section of X invisible human. Boleh besar sikit. Number one. Okay, number one. So this is a cross section of our body. Okay, can you see the line there? The line there. Okay, we can move it up and down. Okay, we can move it up and down depending on which part we want to see. Okay, see, we can move it up and down. We can see exactly which part we want to see. Okay, you want to see the heart, you want to see the lungs, you want to see the head, you want to see the brain. It's up to you. Okay, it's a cross section. All right, and over here we also have the students can actually do a quiz or a presentation. Okay, with this software, you can choose to have it labeled or unlabeled. During exams or during presentation, you can have it unlabeled. Yeah, and then over at the back here, you can see we have monitors over here. At the back here, we have 8 monitors, but due to the restriction on social distancing, one monitor is allocated to maximum of 2. Yeah, 2%. Okay, whatever that is projected over here can be projected direct over here. So students can come in here. All they have to do is make an appointment with us. What day they want to use it, how many students are coming in, and we can open the lab for them. It's open from Monday to Fridays. Okay, any questions you want to ask?
To access this
Software.
they need to be here or they can access everywhere?
No, only in campus. Only in campus. They cannot access outside because this is patented. So you cannot access outside. Yeah. Okay. Any other questions before we go to the next slide? Okay. If you have, then you ask me later. Okay. All right. So So we'll go to the next lab. The next lab is the museum anatomy. But for the museum anatomy, I have to advise you that you're not supposed to take any photos.
Okay.
Yeah. Okay. It's all about learning about the normal and abnormal blood cells. Yeah. That's why we have microscopes. Yeah. When students come in here, they are allocated one microscope per student. Yeah, so that they can see the slides. Yeah. Over here for pathology and histology slides, we have about 3,000 slides over here for students to see. Yeah. Irfan, you can roughly explain what are you showing? What slide are you showing?
Currently is the red blood cell that come up from the bone marrow. As we know, production of red blood cell in our body is come from the bone marrow. So this is a cross section of bone marrow area where the blood coming up and formation of the blood. Roughly, students will learn this as a basic in microscopic lah, where they identify, differentiate different type of blood, tissues, and also layer in the, under our cell lines lah. Mostly here more to theoretical because now here more to theoretical identify what is the cell, epithelial cell and everything lah. Mostly here mostly as I said more to theoretical because preparation of cell mostly we purchase. But later in the future we have our own histology machine lah, how to prepare dish from pure organ into become a slide in future lah.
We have a preparation where we actually prepare the real tissues. Yeah. Okay. Okay. Done. Okay. Now we go to biochemistry. Come. We go to biochemistry. Yeah. Any rotating. Yeah. So this is biochemistry. Biochemistry. Yeah.
Mostly this lab is for chemicals lah, mostly chemicals, everything. So that's why it's quite messy a bit. So mostly because we are preparing for transfer everything. So mostly this biochemistry is mostly basics lah, basics in learning some of equipments that mainly in the laboratory lah. So mostly this lab will be used by our students, mostly not medical students, like Faculty of Science under Biomedical Science, Biotechnology and so on. So besides biochemistry, also we have microbiology downstairs, but we, as I said, still messy a bit because we start to packaging and everything lah. Mostly on chemical preparation lah, this lab and some biochemical practical bit.
Over here is medical faculty, but since we are integrated labs, we have 5 here. We have pharmacy, we have nursing, we have medical, we have dental, and we also have MA, medical assistant. So we all share the labs. Yeah, whenever they need to come to the labs, they will come and they share the labs. Yeah, okay.
Since like I said, this is a fundamental lab like in every science learning. We have biochemistry, microbiology, and so on. So mostly here is more basic lah, more basic equipments that we have for they to learn basic chemical preparation and so on.
So for every labs that the students come in, okay, in Lincoln, before they come in, they have to scan the QR code. Yeah, not the My Sejahtera. The My Sejahtera is downstairs. This QR code is for our medical records, okay, for MQA purposes and so forth, to show that we have followed SOP. So they have to scan the QR code, okay. After that, they have to fill in student log. They have to fill in the student log, and then lecturers have to fill in their logs as well. And students, when they come in for every lab, they have to wear their lab coat. It's compulsory. Students have to wear closed-end shoes. Yeah, no slippers, no sandals. All right. And then when they come in here, especially the labs with chemicals, yeah, which is biochemistry lab and microbiology lab. Okay, they have to wear gloves. Yeah, because they are dealing with a lot of chemicals. So for safety purposes, okay, they have to wear gloves. They have to make sure they wear their lab coats, okay. And any spill, if there's any spill or anything like inside there, there is a wash. You can see the yellow wash, yeah, there's a wash there. We also have first aid kit here, okay, and there's also a eye wash just in case anything that goes into their eye. They have an eye wash here, and then as you can see just now, in every lab we have the what do you call it, the person in charge. Okay, so the person in charge, whatever way, if you are facing any difficulties or anything like that, you call the person in charge. Yeah, the phone numbers and so forth is there. You call the person in charge, the person in charge will come. Okay, and if there's any spill or anything, students will have to immediately evacuate the lab. Yeah, and then the MLTs or whoever, the person in charge, will come in, okay, do the necessary, call the necessary people or so forth to clear the place. Yeah, any breakage, any chemical spills, anything like that, the MLT will actually, the person in charge will actually do the necessary to, you know, call the necessary people. Yeah, okay, all right. Okay, come. The next step that we're going to is physiology lab.
Christina asked the officer, are you doing it?
Okay, please. Can you explain that? Please, go in. Yeah, please go in. Bart, you cannot see my lab, because my lab is in a mess. So no skills lab today.
Okay.
It's in a mess. The whole thing has been taken off already. Yeah, so no point saying that. Maybe next time when we go.
So you see, we do some inventory before we move out. That's what you see there. So mostly physiology lab is, as you know, the anatomy just now. They learn about everything, the organ, everything. However, in physiology, they will learn the functions of each that one. So they use every PC here, and also it has some slides that to show to see, for example, the abnormal and normal blood. Compared to histo, they focus on histo side. Here focus on function of the red blood cell itself. So mostly lecturer will use, after they having the anatomy, they also have this session to see, to learn. For example, just now we learned the head, right? We have skeletal, have muscle, have nerve, everything. But here we learn more to function, more to, they will access a software also here to learning each part of the anatomy and their functions. Mostly here more to face, not theoretical and virtual, because besides face-to-face session, lecturer also use Zooms online, because due to social distancing and everything, mostly lecturer will access from here, and they also get access from home this software mostly.
Students here also learn about just basic things, yeah, basic things like how to do a BP, how to take a BP, yeah, maybe also about blood. What kind of blood do you belong to? Yeah, blood group do you belong to? So simple things like that are also being done in this lab. Yeah, for students to learn basic things.
As
Yeah.
here, mostly the facilities is fulfilled only for first year and second year medical students. As you know, the third year to fifth year, they will be in Kota Baru. So the facility is fulfilled for first year and second year lah. Not much advanced, but it's mostly basic and fundamental in learning lah.
Because for medical students, only year 1 and year 2 is here. Year 3, 4 and 5, they'll be going to the, this is called preclinical. Year 1 and year 2 is called preclinical years, yeah? Year 3, 4, 5 are called clinical years. Clinical years, which means that they actually go to the hospital, yeah? Whatever they learn from here, okay, will be you know, they will be taught even more in advance when they see the real people or the real patients over there, okay? Like my skills lab, okay? I'm sorry you cannot go to my skills lab now because it's in a total mess. We are in the midst of relocation, but there are actually there are lots of interesting things over there to see, okay? Like in skills lab, like my skills lab, okay, I'll just explain roughly what they do there. They, year 1 and year 2, they actually come into my lab for practical sessions, okay? Practical sessions, a lot of practical sessions that they can learn from there, like venipuncture. How do you take an IV, you know? How do you do venipuncture? Venipuncture means how do you take a blood from a patient. But I have the mannequin, which they can actually learn how to take blood, okay? I also have a model which they learn about cardiopulmonary, like how do you listen to all the different heart sounds and lung sounds. Okay, I have a lot lah, God knows how many I have. And I also have a model child, which student will actually learn about pediatric, all the pediatric care. Okay, and when students come in there, in the skills lab, OSCE is also being held. OSCE and OSCE is being held. Whenever we have a OSCE, we actually have what you call simulated patients. Okay, simulated patients are professional, normal people. Okay, from outside, which either being trained or I train them for history taking and physical examination. So whenever they come in there for OSCE, they are given a script for history taking, they're given a script, and then they will become the patient in the script. Students will learn about communication skills, okay? Because when you go to the hospital, you have no time for communication skills, because you're supposed to know how to talk to a patient, how you treat a patient, how you talk to a patient. You're supposed to know all that already. So when they are here, they actually practice it over here, okay? So the skills are actually practiced here, okay? When they go in there, it's all about the real thing. It's all about the real patient already, yeah? And over here, we also have the simulated patient for physical examination, which means they are professional people. They are being trained. So for, say, physical examination, our patients, sometimes we can have male, sometimes we can have female, okay? It can be anybody, it can be your mother, your sister, your brother. They can apply to be a simulated patient, okay? But when simulation is done for physical examination, it's all on the, like say, arm, legs, head, no private parts, okay? So we do have that here as well. So student can have a feel and practice how do you talk to a real patient, okay? Before they actually see the real patient in the hospital. Yeah, okay? All right. Nursing, but as I told you, we are integrated lab, so we do share. Yeah, but this is more of nursing. Yeah.
Are you enjoying so far?
Yeah.
It can help you.
Sorry.
It can help you to to motivate.
Yes. Okay. After because they want to go in shift to the
Can we make a video?
hospital setting.
It's a hospital setting. But mostly solution what will be used by medical assistant students and also nursing students lah. So every medical here they have their own functions lah. And also in skill lab we have everything like this, almost like the same lah, but because they are the maintenance to fill up, so this almost the same skill lab. So every medical here they have their own function lah. So mostly nursing students will use here mannequin to train lah, mostly for their clinical exam or physical exam lah, depends. So mostly this mannequin have, as I said, have their own functions, and mostly they will use for simulation during examination, like renal function and everything lah. As I said, there is also a preparation room lah. Every lab they have their own preparation lah.
Okay, what is important here for the nursing students is when they come in here, they actually have to know about the emergency trolley and the medication trolley. Okay, this is emergency trolley, this is medication trolley. Okay, why do they have to know? Because when they go to the hospital, these are the two very important trolleys. Okay, emergency trolley is all the equipment on how to revive a patient. Yeah, or say supposing a patient come in having asthma, they cannot breathe. Okay, what are the equipment that you use? Everything is inside here. Okay, you call the revival equipment. Okay, this is emergency trolley. Okay, this is medication trolley. Especially the nursing students, they have to learn about medication, each and every medication. So we have all the different kinds of medication over here. Students will have to identify the name of the medication, what is it used for, when do you use it, who do you use it for, what occasion do you use it. Okay, so medication trolley is something which especially nursing students and MA, medical assistant, have to learn about this trolley, both this trolley, which is very important. Okay, over here we also have ECG. Students also learn about ECG, and at there is actually a real ECG machine. They also do it sometimes, not sometimes, because ECG you cannot do it automatically. Okay, because you cannot get the hearts. I mean the you know, yeah, the breathing and all that. So you have to do it on the patient. So what students will do, they'll do among themselves. If the female, they'll get the female to do it. The male, they get the female. So we have to do it ECG. Over here also the OSCEs is being done over here. Yeah, okay. And since this is a big place, you know the CPR, okay, CPR. Whenever there's a CPR session, we usually conduct it here because this is a bigger space. Whereas my skills lab is very small, so we do it here. We can actually set up all the different CPRs. Yeah, the child, the adult, you know, and we can also students actually also learn about defibrillator. Okay, how do you say, supposing the heart stop, you know, in the hospital, and there's a patient, yeah, is not breathing, you know, on top of doing the CPR, yeah, you do the poof, yeah, that we call it the defibrillator. Yeah, students also learn about defibrillator. How does what's the function of a defibrillator? Yeah, over here. Okay, right.
So here mostly a microscopy and also some bacteria culture behind preparation. So mostly students will learn about the basic microbiology technique, aseptic technique, and so on. So mostly here more to microscopic because when you're doing culturing the bacteria, we see the shape, so they will identify and classification everything. So I say this is most fundamental in science. So every faculty will use this lab, rotating based on their schedule and everything. Besides microbiology, mostly, as I said, most of the science students will use, as I said, the basics. Every student will have one microscope for more easy to during practical sessions and then we have a bioreactor, some water bath and everything and mostly for micro using in this lab
You can just take a look.
Preparation.
Yeah. That's fine. Oh, you haven't been here. This one a lot of bacteria control.
So here is the preparation, so all the instrument will be prepared here, and that is the media so the chemical to prepare the agar and everything So mostly as you want to shift things, so mostly so it's quite nice but mostly maintenance will done every based on the timeline So every year we will do the maintenance for every machine and instrument in order to have a safety and good product preparations
Maintain the quality.
Yeah, the quality is important. Okay. Besides microbiology lab here, we also have anatomy lab.
Before that, I just want to inform you that we are very strict with the students here regarding the COVID-19 SOPs. Okay, for medical students, whenever they come in for exams, especially, yeah, they are required to take their temperature. Okay, because we cannot be sure. Yeah, because if you come in here, you just say like us for our medical faculty, we actually have a temperature scanner. Okay, so before they go up to the hall, the examination hall, we will scan their temperature first. Okay, make sure that every time when they come into the campus, they have to wear mask. It's compulsory to wear mask. It's compulsory to scan the temperature. Okay, to make sure, because we don't want any what do you call it, outbreak. Yeah, so we always make sure that our students' temperature are always normal. Okay, and if the students are compulsory, we will not allow them to come to campus. Yeah, they have to be quarantined at home. Yeah, we will not allow, and then allow them for at least 5 days if they are fully vaccinated. If they haven't got their booster yet, it's 7 days. Yeah, if boosted, it is 5 days. Yeah, and students have to, like this lab also, because they are dealing with bacterial culture and so forth, they also have to wear gloves when they come in here, fully what do you call it, with their lab coats. Yeah, shoes, lab coat, shoes, mask, and
Gloves.
gloves. Yeah, it's compulsory. Okay, all right.
Here is dental for their practicing lah. So you can see the primary care for clinical lah. Here also we have X-ray room, but for dental recovery, as you know, we have a clinical dental, official clinical dental. So everyone who want to do the treatment in dental also can have X-ray session here lah. Okay, from here, this is the anatomy room, anatomy lab. Mostly here is more to
You haven't been here yet? Oh, okay.
virtual upstairs. We see the fluorescinated. So student here also can touch that really each organ, each system, each tissue that they see virtually. They can see plastinated one. So mostly students will come here to learn their stuff, or with the system with lecture and
The reason is so that students can have
yeah,
each and every student can have each module
touch
hands on.
everything lah.
Okay.
Learn everything. Yeah.
So these are plastic models, okay? Plastic models. Over the end there, we have those are real bones. At the end there, that white cabinet, at the end there, those are real bones. Can be. Okay, right. Yeah. Okay, I just want to explain to you about the tables here. Yeah, these are not normal tables. These are tables you can see if students want to take the plastic model or plastic model. There is one they can put the table and they can see. But this table is also known as a dissection table. Lift it up, okay? It can be used as a dissection table. Okay? So we have the body inside the tank. Okay, the body can be brought out here for dissection. Yeah, okay? So inside the tank here, this is called a dissection room. We have 3 bodies inside the tank here. Inside the tank here, okay? We have 2 females and 1 male. 2 males and 1 female inside the tank there. Yeah. So whenever our lecturer want to teach the students about dissection, if required, we can take the whole body out, or we can take a specific part of the body. Okay? Like say supposing they want to see just the brain, or they want to have the specific part in class. Okay? Rashad, where are you?
Used to work here, used to study here, used to accept real patients.
तो दोस्तों, ये थी हमारी लिंकॉन यूनिवर्सिटी एंड कॉलेजेस का मेडिकल कैंपस, जिसके अंदर MBBS और डेंटिस्ट्री के हवाले से बहुत ज़्यादा आपने इंफॉर्मेशन भी हासिल की होगी। आपने वहाँ की लैब देखी, आपने इस यूनिवर्सिटी का ओवरऑल एक व्यू देने की हमने कोशिश की थी, जिसके बाद आपके लिए एक आसानी हो जाए अपना डिसीजन फाइनलाइज करने के लिए। इसी तरीके से दोस्तों, हम चाहेंगे कि हम अपनी बाकी यूनिवर्सिटीज़ जिनके साथ हम एफिलेटेड हैं मलेशिया में, हम सब का आपको यूनिवर्सिटी टूर कराएं, ताकि आपके लिए मज़ीद आसानी हो और आपके लिए मज़ीद रास्ते खुले मलेशिया जाने के हवाले से। तो ज़रूर आज की हमारी वीडियो को लाइक कीजिएगा, शेयर कीजिएगा, हमें अपना फीडबैक ज़रूर दीजिएगा कि आपको इस यूनिवर्सिटी में क्या क्या चीज़ें पसंद आए, और अगर आपको कोई चीज़ लगी कि आप मज़ीद हमसे भी पूछना चाहते हैं, तो ज़रूर हमसे राब्ते में रहिएगा। दोस्तों, बहुत बहुत शुक्रिया। Thank you very much. Allah.